Hi, I'm Jer, and I've been working on this medical English lesson for the past month, and finally I get to share it with you, and I'm genuinely excited. Whether you're a student nurse just entering healthcare in English, a first-time doctor, or really any healthcare worker, this video is for you. It contains 100 phrases to get you through your working day in English. If this is your first time with the channel, my name is Jer, this is Learning English Pro, the channel for healthcare professionals like you to excel in English and advance in your careers. Every week, I publish brand new English lessons for nurses, doctors, and other healthcare professionals, so make sure to subscribe to get updates on all my lessons. Now, before we jump into the lessons, I want to show you something I'm exceptionally proud of. I've created a masterclass guide for this lesson. It's available in my YouTube store. You'll see it just below the video and in the video description. It contains all 100 phrases fully explained with vocabulary and grammar notes. You'll find exercises for each of the sections that we cover in today's lesson. Exercises include speaking drills, role play exercises, and lots of reading. And you'll find some handy tips from a new special friend who I'll introduce later on in the video. And if you're a student member, thank you so much for your support, by the way. This guide is available to you as part of your membership. If you want to join the student membership and save lots of money, you can join it. The link for that is in the video description as well. And now it's time for our lesson to begin. I hope you enjoy this lesson on 100 English phrases every student nurse should know. At the beginning of your shift, you'll be getting updates from colleagues, preparing to care for patients, and establishing yourself as part of the team. These next phrases will help you sound professional and confident as you get started. Let's check out our first phrase. I'm just starting my shift. This is a simple and clear phrase to let others know that you've arrived. It's especially useful when you enter a room or join a conversation and want to explain why you're asking questions or catching up. Our next phrase is, can I get a quick handover? This is a useful phrase when you're taking over from another nurse or student. Handover refers to the transfer of patient information between shifts. In American English, you might hear change of shift report instead. Has the patient had any changes overnight? This phrase helps you find out if anything important has happened during the night shift. You're asking about physical, emotional, or behavioral changes. What's the care plan for today? You can use this phrase to show that you're thinking ahead. It helps you understand the day's priorities for a patient. Care plan is a standard nursing term, and by asking this, you show your awareness of the bigger picture. I'll go check on my assigned patients. This phrase shows that you're organized and ready to take responsibility. The word assigned is important. It means these patients have been allocated to you, which is common language during clinical placements or shifts. I'm still a student, so I'll need supervision. This is a professional way to clarify your role and to remind others that you're not fully qualified yet. Saying still a student shows that you're progressing, and the phrase needs supervision sets clear expectations for patient safety. Can I shadow you for this procedure? This is a great phrase for learning on the job. When you say shadow, you're asking to quietly observe someone more experienced so you can learn while watching. It's polite and respectful and shows that you're eager to learn. Is there anything urgent I should know about? This is a smart question to ask during handover or at the start of your shift. It shows that you're focused on what matters most and that you want to prioritize patient safety. Let me know if I can assist with anything. This is a helpful and collaborative phrase. You should use it when you're talking to nurses, healthcare assistants, or other team members. It shows that you're ready to help and that you understand teamwork is a big part of nursing. I'll make sure to document everything. Use this phrase to show that you understand the importance of accurate documentation. Document is a formal word meaning to record information. Saying this out loud can help others trust that you're being thorough and careful. So that is our first batch of 10 phrases, all relating to starting your shift. Student members and those who have bought the PDF guide should turn to page 6 for the first exercise in the guide, which covers these 10 phrases. Next up, let's move on to our second section and our next batch of phrases. Section 2 is all about patient communication. Speaking with patients is one of the most important parts of nursing. These next phrases will help you sound more confident, caring, and clear, even when you're nervous or new to the role. Hi, my name is Jer and I'm a student nurse. This phrase is your go-to introduction. It builds trust with the patient by telling them who you are and what your role is. Keep it friendly and keep it professional. Saying you're a student helps set realistic expectations while you sound confident. How are you feeling today? This is a gentle, open-ended question that invites the patient to talk. It's a great way to check in and start a conversation. The word feeling lets them talk about pain, emotions, or general well-being without pressure. Let's move on to our next phrase. Let me explain what I'm going to do. This phrase is useful before starting any task or procedure. It helps the patient feel involved and respected. Let me explain is soft and clear, and it shows that you care about their comfort and their understanding. Is it okay if I check your blood pressure now? This is a polite way to get consent before a routine task. The phrase, is it okay if, shows that you respect the patient's autonomy. You might feel a little pinch. Use this phrase before giving an injection or doing anything that might be mildly painful. Saying a little pinch helps to prepare the patient while keeping it light and non-threatening. Tell me if anything feels uncomfortable. This phrase encourages patients to speak up. It shows that you're paying attention to their comfort and their needs. The word uncomfortable here is really useful as it's broader than pain, so it invites them to mention pressure, tightness, dizziness, or anything unusual. I'll be right here if you need anything. This phrase reassures the patient that they're not alone. It's great when you need to give someone space but still want to make them feel supported. It builds trust and emotional safety. We're going to help you sit up. This is a calm way to describe a movement or transfer. Using we creates a feeling of teamwork, especially if you're working with another nurse or HCA. I'll explain each step as we go. This phrase is very helpful when doing unfamiliar or slightly uncomfortable procedures. It lets the patient know that you'll keep them informed throughout, which can reduce their anxiety. Thank you for your patience. Our last phrase in this section is a professional and kind way to acknowledge that something has taken a while, whether that's waiting, discomfort, or delays. It shows respect and builds rapport. Well done, that is another 10 phrases under your belt. Which of these phrases are you most likely to use first? Let me know in the comments, I'd love to hear from you. For those with the PDF guide, turn to page 9 for a really great reading exercise that will test your understanding of these phrases. Okay, section 3, medical procedures and tasks, a really important section. As a student nurse, you'll take part in lots of hands-on tasks with patients. These phrases help you communicate clearly, prepare patients, and show professionalism during procedures, even when you're still learning. Our first phrase is, I'm going to check your vital signs now. This phrase is clear and reassuring. Vital signs refers to things like blood pressure, temperature, heart rate, and respiratory rate. Saying, I'm just going to, gives the patients a heads up while keeping it friendly and structured. Would you like some privacy while I do this? This phrase shows that you respect patient dignity, especially during personal or sensitive tasks. I'll just raise the bed slightly. This phrase is helpful when you need to adjust the patient's position. The word just makes the action sound small and non-threatening. Can you roll onto your side for me? This is a simple instruction often needed during bed care or wound checks. Adding for me keeps the tone gentle and polite. Let me know if you feel dizzy at any point. This phrase encourages open communication during or after movement. Dizziness can be a sign of low blood pressure or other issues, so this helps keep things safe. I'll clean the site before we begin. Use this phrase when preparing for injections, dressings, or IVs. The site is professional terminology for the specific area of the body that you're going to attend to. I've washed my hands and put on gloves. This phrase is useful to say out loud, especially for infection control. It helps the patient understand what you're doing and builds trust. Can you confirm your name and date of birth? This is a critical safety phrase, especially before procedures or medication. It ensures you have the right patient, and using the word confirm makes it sound official but respectful. I need a nurse to supervise me for this task. This is a clear and professional way to ask for support. It shows that you're aware of your scope as a student and committed to safe practice. I'm not qualified to do that yet, but I can assist. This phrase sets a firm boundary while showing that you're engaged and willing to help. And that brings us to the end of this section. Altogether, that's now 30 phrases that you've learned. Well done. If you're enjoying this English lesson with Learning English Pro, make sure to subscribe to get regular updates on all my new medical English lessons. Our next section is all about medication and monitoring patients. Medication is, of course, one of the most important and sensitive areas of nursing. These phrases help you speak with confidence while staying within your student responsibilities and communicating clearly with patients. Have you taken your medication today? This is a useful and routine question to ask patients, especially during rounds. It uses the present perfect tense, have you taken, because you're asking about something relevant to the current moment. This is to help with your pain. This phrase gives a quick explanation for a medication or treatment. I'm just double checking the dose. This is a great phrase to use out loud. It shows that you're being careful. Double checking sounds positive and responsible. Can I check your blood sugar level? You'll use this often for diabetic patients. It's a polite and straightforward request. The phrase blood sugar level is understood by most patients. Let me write this in the drug chart. This is a practical phrase that shows you're keeping up with documentation. Drug chart is the UK term. American nurses might say medication record. I'm not allowed to administer medication on my own. This phrase is essential for maintaining safety. It's firm but respectful and reminds everyone that you're following your training requirements. The nurse will be here shortly to give you that. Use this phrase when you can't administer something yourself. The word shortly is polite and non-specific. It keeps the patient informed without making promises about exact timing. This is a routine check for side effects. This phrase helps normalize a conversation about side effects. It's especially helpful when asking sensitive questions. Routine makes it sound expected and reduces anxiety for the patient. Have you noticed any changes since taking this? This is an open-ended way to monitor a patient's response to medication. The word changes is broad and allows the patient to share anything from physical symptoms to mood or sleep differences. Let's check out our 40th phrase. We'll keep monitoring this throughout the shift. This phrase is a great way to reassure patients that they're being looked after. That's already 40 phrases that you've learned. You're doing fantastically. If you've already downloaded the PDF guide, pause the video and have a go of the exercise for this phrase section on page 13. It's a fun exercise which focuses on grammar and professional tone. Bringing us up to the halfway mark is Section 5, Working with Colleagues. Student nurses are part of a larger team. These phrases help you communicate clearly with staff, show initiative, and build professional relationships with other healthcare workers. Can I assist with anything? This is a friendly and proactive way to offer help. It shows that you're a team player and willing to support your colleagues. Would you mind showing me how to do this? This question is great when you're learning something new. Would you mind is a polite and respectful way to make a request without sounding demanding. I've done this before, but I'd like supervision. This phrase shows maturity and professionalism. You're letting people know that you've had experience with something, but you still value safety and feedback. Should I document that in the notes? This is a helpful phrase to ask when you're unsure about whether something needs to be recorded. What's the priority right now? Use this phrase when things are busy and you're not sure what to focus on. It shows that you're thinking critically and want to contribute in the most effective way. I can take the obs in bed 4. This is a confident way to show initiative. OBS is short for observations, a common abbreviation in UK and Australian hospitals. I'm happy to help with the turns. Turning patients is essential for pressure care and often done in teams. This phrase shows that you're not afraid of physical tasks and that you value patient comfort and safety. And when you say you're happy to help, it also signals enthusiasm and team spirit. Can you check if I've done this correctly? This phrase is key to safe learning. It shows that you're open to feedback and want to get things right. Sorry to interrupt. Quick question. This is a useful one when you're in a busy environment. It acknowledges the other person's time while still making space for your learning. Thanks for explaining that. Really helpful. This phrase is always a good way to express appreciation when someone has taken the time to teach you something. Have you ever had a difficult moment with a colleague? Which one of these phrases would you use to soften a situation? Let me know in the comments. I love hearing from you. We are over the halfway mark of our 100 phrases. Now it's time to move into section 6, managing emotions and stress. And don't forget, on the PDF guide, all the content from today's lesson is included. If you want to follow along with this section, turn to page 22. Nursing can be emotionally intense, especially during your student placement. These next phrases help you talk about stress, ask for support, and process difficult moments with honesty and professionalism. Let's check them out. That was a bit overwhelming. This is a useful phrase to say after a difficult experience. It's honest, but not dramatic. A bit softens the emotion while still acknowledging that you're affected. Can I take a moment? This phrase is simple but powerful. It gives you space to breathe, especially after something emotional, like a patient passing away or a challenging interaction. I found that situation quite upsetting. Use this when debriefing with a mentor or nurse after a tough moment. Quite upsetting is a controlled way of expressing emotion. It's professional, but still human. Do you have any advice on handling that better next time? This is a reflective and mature phrase. It shows that you're thinking about your own performance and you want to improve, especially after a mistake or a stressful situation. I'm not sure how to respond in these situations. Use this phrase when something catches you off guard. It's better to admit it than pretend to know what to do. It opens the door for learning and shows that you want to do things right. Could we debrief about what happened? This is a professional way to request a follow up conversation after something challenging or intense. Debrief is common terminology in healthcare, and it shows you're processing things in a thoughtful, clinical way. That was a really emotional moment. This phrase helps you connect with your experience honestly. It works well in both formal debriefs and informal chats with colleagues. It allows others to validate your feelings and support you. I'd appreciate a bit of guidance on this. This is a respectful way to ask for emotional or practical support without sounding unsure of yourself. A bit of guidance keeps the tone soft and open rather than sounding like a formal request. I just need a minute to gather myself. This phrase is helpful when you're feeling flustered, upset, or even overstimulated. It helps set a gentle boundary while showing your own self awareness. Our 60th phrase is I'm still learning how to cope with these situations. This phrase is useful when reflecting on your growth. It shows that you're developing resilience and that you know emotional regulation is part of the job, not something you'd expect to master overnight. Over the years of teaching medical English, I've found this type of language which deals with emotional stress really important for healthcare professionals. Repetition is key, so make sure to come back and practice these phrases. Each section is timestamped in the video description for easy navigation, so you can jump to the section that matters most to you. Staying on the subject of mental health and emotions, our seventh section deals with difficult conversations with patients. Sometimes you'll need to handle conversations that are awkward, emotional, or even distressing for patients. These phrases help you remain calm, compassionate, and professional, even when the topic is sensitive. I'm really sorry you're feeling this way. This phrase has a lot of compassion when a patient expresses distress, pain, or sadness. Really sorry shows genuine empathy without taking personal responsibility. I understand this must be difficult for you. This phrase helps you connect with the patient's emotions. You're not claiming to know exactly how they feel, but showing that you can imagine their struggle. It builds rapport without making the situation about you. I'm not able to answer that, but I can find someone who can. And here we have a professional way to respond when a patient asks a medical question outside of your scope. It sets a boundary clearly and respectfully while still offering to help by escalating the issue to someone qualified. Would you like a bit of time before we continue? Use this when a patient seems overwhelmed or upset. It's a great way to offer the patient space without being too pushy. It's okay to feel upset. This phrase normalizes the patient's reaction. It's short, kind, and powerful. Sometimes patients just need permission to cry or vent without feeling judged. Let me know if you prefer not to talk right now. This is a really thoughtful phrase that respects the patient's need for silence or for space. It shows emotional intelligence and gives the patient control over their interactions. I can stay with you until someone else arrives. Use this phrase when a patient is waiting for a doctor, a relative, or a difficult update. It shows presence and support, two things that are often more helpful than words. I'm here to support you in any way I can. This phrase is broad but comforting. It doesn't make any promises, but it shows that your role is more than physical care. It's about emotional presence too. We're doing everything we can to help. This sentence can bring reassurance in tense moments. It helps patients know that even if something can't be fixed instantly, action is being taken. And we say we here to reflect the whole team's effort. I'll stay with you while we wait. This phrase is great when patients are scared, in pain, or receiving care that takes time. Simply offering to stay can mean a lot, especially in unfamiliar or frightening environments. Every section in this lesson has an accompanying exercise in the PDF guide. If you're not a student member and want to check it out, it's available to purchase in my YouTube store, and it's also linked with this video. The exercise for this section on difficult conversations with patients is an AI role play you can upload to ChatGPT or Gemini and have a great conversation practice. Let's move on to section 8, handling mistakes and uncertainty. Now, everyone makes mistakes, even experienced nurses. What matters is how you respond. These phrases help you stay accountable, professional, and committed to learning when things don't go perfectly. I made an error and I want to report it properly. This phrase shows maturity and responsibility. Owning your mistake and reporting it through the proper channels is a key part of professional growth. I'm not sure about this. Can I double check it with you? This is a confident way to ask for clarification. I'm not sure doesn't mean you're failing, it shows that you're thoughtful and want to get it right. I think I missed a step. Can we go over it again? And here we have a great way for reflecting during or after a task. Missed a step keeps the tone gentle while still being honest. It opens the door to repeat learning without fear. I need more guidance on this process. This phrase tells your supervisor that you're keen to understand, not just complete the task. A bit more guidance is soft but clear and keeps you in the mindset of continuous improvement. I didn't feel confident doing that on my own. Use this statement after a procedure or when giving feedback to your mentor. It shows self awareness and prioritizes patient safety over your own ego. It's always okay to say this. Could we talk through what went wrong? This phrase is helpful after a difficult situation or a mistake. Talk through sounds collaborative and solution focused, not accusatory. It shows that you want to reflect and to improve. Next time, I'll try to approach it differently. This is a reflective phrase you can use when reviewing your own practice. It shows a growth mindset and signals that you're learning from every experience. I've taken note of that for next time. This is a great phrase to use when receiving constructive feedback. It shows that you're actively listening and integrating advice without becoming defensive. Thanks for the feedback. It really helps. This one is always useful after someone has corrected or guided you. This phrase keeps things positive and encourages your mentors to keep supporting your development. I'll add this to my reflective journal. This is a professional way to show that you're taking responsibility for your learning. Reflective journals are part of many nursing programs, and mentioning it signals that you're serious about growth. It's time to introduce my new friend, the Learning English Pro mascot. His name is Brainy. Brainy's here to give you lots of advice and additional tips to help you boost your professional English. And Brainy's first tip for you is probably the best for any English learner. Studies have shown that the best way to learn English is to talk about it with another English learner. So share this video with a colleague or friend, watch it together, practice and discuss the topics. This is a proven way to maximize your English learning. We are into our final 20 phrases of our lesson. Well done for getting this far. Section 9 is all about asking questions and clarifying. One of the best things you can do as a student nurse is to ask questions. These phrases help you seek clarification in a professional, respectful way without ever feeling like you're getting in the way. Could you explain why you're doing this? This is a great way to ask about the reasoning behind a task or treatment. Could you explain sounds polite and curious, not critical. It's an excellent phrase to show active learning. Is this the usual procedure for this situation? Use this question when you want to understand patterns and protocols. It shows that you're thinking beyond just copying actions. You're trying to understand the best practices. What would you do differently in this case? This phrase invites experienced colleagues to share their judgment. It's a fantastic way to learn how to adapt to specific patient needs and to build your own critical thinking. Can you walk me through the steps? This is a calm and professional way to ask for a breakdown of a process. Walk me through is more conversational than explain, and it works well when you're about to assist or try something new. Why do we monitor this so closely? This question shows that you're thinking about the purpose behind nursing actions. So closely adds focus, helping you understand risk factors and the importance of precision. What signs should I be looking out for? This fantastic question is especially helpful in patient monitoring. It signals that you're paying attention and want to learn what clinically matters. Do you have any tips for doing this more efficiently? Another great question here. Use this to ask for shortcuts or professional habits. Efficiently shows that you value time and effectiveness, which is essential in busy wards and hospitals. I'm not quite sure I understand. Could you show me again? This phrase is a gentle way to admit confusion without sounding lost. Not quite sure softens the sentence, and show me again signals that you're actively trying to get it right. I've read about this, but I haven't seen it done before. This phrase shows that you're prepared while acknowledging your inexperience. It's great to say before observing a new skill or a new procedure, as it encourages your supervisor to narrate or explain as they go. What would the risks be if we didn't do this step? Here is a very high level question that shows critical thinking. It helps you understand not just the how, but the why. On the downloadable PDF guide, the exercise for this section is on page 34, and it's all about upgrading the question how you can transform your basic English into sounding more clinical and more professional. If you've gotten this far into the lesson, well done to you. You're showing a lot of dedication to being a fantastic English speaker in a medical setting. At the end of your shift, it's important to close things off properly, hand over clearly, and reflect on what you've learned. Our final phrases help you wrap up your day professionally and mindfully. I've handed over everything to the next nurse. This is a clear and confident way to say you've transferred responsibility. It reassures your supervisor that you followed proper protocol. Is there anything else I should finish before I leave? Use this phrase to show responsibility and willingness. It helps you make sure nothing's been forgotten, and it shows that you value the smooth running of the shift. I'll tidy up my station before I go. This phrase signals professionalism and respect for the team. Keeping your area tidy helps the next shift and reflects pride in your role. Thanks for all your support today. You should use this statement to show your appreciation to your mentor, nurse, or anyone who's helped you during the day. Gratitude helps build strong relationships and leave a positive final impression. I learned a lot during this shift. Here we have a simple but powerful phrase. It shows that you're reflecting and growing. It's a great thing to say during debriefs or when thanking someone for their time. I found this part of the shift quite challenging. Use this phrase to reflect honestly. Quite challenging keeps the tone professional. It's a good entry point for constructive feedback or journaling. I want to practice that skill again soon. Here you're showing initiative, whether it's an injection, wound care, or communication task. Naming it helps your supervisor support your learning goals. What would you recommend I focus on next time? Here we have a fantastic question for mentors or preceptors. It turns the end of your shift into a coaching opportunity and helps you move forward in your development. I'll add that to my portfolio. If your course requires a skills log or reflection, this phrase shows that you're staying organized and taking your placement seriously. And now it's time for our final phrase, number 100. See you tomorrow. Have a good evening. And finally, this phrase is warm and professional. It ends your day on a positive note and shows that you're becoming a part of the team. Congratulations on finishing this lesson. You've just learned 100 English phrases every student nurse should know. And it's no small feat. It's like you've just done a mini course in medical English. Whether this is your first time or your fifth time watching this lesson, I encourage you to come back for more. Repeat the phrases, try out the PDF, and see how you go. And make sure to share it with a friend. Don't forget Brainy's tip. Sharing and working together is the best way you can learn English. And if you enjoyed seeing Brainy, check out my YouTube store where there's lots of Brainy merch for you to have a look at. If you found this course useful, consider joining the student membership where all PDFs are available as part of the membership fee. On screen, you'll see a link for one of my videos on 100 phrases for nurses. It's one of my top videos at the moment. So that's all for now. I'm Jer, this is Learning English Pro, and I'll see you in the next medical English lesson.